Hi everyone. In this cold weather, I am hoping that you are keeping absolutely warm. We are here at Meditest, and yes, they are our sponsors of Set to Succeed. Once again, I have Dr. Rajesh Chaudhary with me. Thank you so much for coming back.
Hi, hello, hi.
How are you doing?
Vandana is not going to leave me.
I am not going to leave you. And just for all those people who might have not seen the previous episode, just to let you know, he is a urologist. Maybe a small background will help again of what exactly you do.
Yeah, I'm a urologist and a kidney transplant surgeon, trained in India and now based in Meditest, working since last 6 to 8 months. As you know, Meditest is a premier daycare center based in Westlands. It is having a state-of-art lab where we do all in-house tests, and along with that we have a 25-bed in-house chemotherapy. Okay. And full-time dedicated to onco physicians, hemato-oncologists as well as radiation oncologists. Along with that, we have state-of-art CT scan and MRI with a mammography, dental, as well as we have eye clinic with the full-time ophthalmologist along with us, and a dental clinic.
Okay, perfect. Yeah. All under one roof.
Yeah, all under one roof. No need to go anywhere. Along with that, now recently we have also launched our app. So none of them have to, you have to visit that lab. You can call ourselves. We come to your place. We take your samples, and we don't charge anything. Along with that, if you order by our app, you get a discount of 15%.
Okay.
Yeah, you can download from our Play Store, and you can take the benefit of that.
Okay, so you need to dial the numbers right down here, and of course, download that app. I mean, who doesn't want it to be easy? Make sure that you get your tests done at home, at your own comfort, at your own time. Today with Dr. Rajesh, what we shall be discussing is something very important. It is prostate. And
yeah, prostate is very important. Every female should be worried about because that is related to your male partner. Right. Prostate is basically a small gland, just like a walnut size. Okay. It is based as your bladder, just below the bladder. And the most important part of prostate is very important. It takes important part in the sexual function of a male. Okay. It produces the semen, which is important for nutrition for the sperm. So prostate is a very, very important part of a male life, and as you grow old, as your gray hairs become gray, prostate size increases in size, and that is when prostate starts bothering every male, So, and the most important part of prostate is grows very slowly, and even the more important part for prostate, which is bothering the male right now, which is an epidemic like in the whole world, it is one of the most common cause of prostate male death after cardiac. Oh, wow. After heart disease, prostate cancer is one of the most common cause of death in the male. It's like a slow cancer. You never know, just like kidney disease, you never know prostate cancer whether you are harboring a cancer or not, and it goes on till the end stage. Okay. So once a prostate cancer develops, the male will not be able to know whether he is suffering from prostate cancer or not. So for prostate to diagnose early part, every male should go for a routine, simple blood test that is called serum PSA. He has to consult his urologist. At the same time, he has to do a ultrasound test. Now, looking into that aspect, Meditest has developed a special package that is called Male Sexual Health Evaluation Package. Okay. With that, we provide a comprehensive test along with a blood test with sonography and urologist consultation. Okay. So they just have to come, enroll themselves in this test, and we do whole evaluation of their prostate as well as sexual health. Okay. So that if you are suffering from prostate cancer, you come to know at early stage. Now, the most important part of prostate cancer is the early you diagnose, it's 100% curable. Oh, okay. It's 100% curable. That's so good to know. Even if you are having cancer, in the early part, stage 1, stage 2, once you remove the prostate by surgery, it's totally cured. So you are disease free.
That's good to know.
That's a very important part. So that's why we are promoting. Meditest has a special campaign. We are taking it on a very bigger scale in future along with our cancer team. Okay. We are going to make a program. We're taking part with the health government, with the government of Kenya. We want to make an awareness of prostate cancer just like cervical cancer. Every male should be evaluated, a must, so that if he's suffering from that disease, we treat them and they are completely cured. And for that, that's why we have made this special package, which everyone can take benefit of it.
This is a fabulous thing to know for sure. Yeah. So is it done once a year or how
Just once a year.
Just once a year.
Just once a year you come down to the Meditest, we do the evaluation, and you know whether you are suffering from that or not.
Okay.
Yeah. Along with that, that is the cancer part. See, prostate enlargement takes two types. It's a cancer or it's a benign. Right. Now, if you have cancer, you treat it as accordingly. Now, the enlargement of prostate takes part in the benign part also, wherein all males will have problems in passing urine. The first symptoms, any male after 50 will have frequency of urine. Like every half an hour he has to go to the pass urine. Right. That is one thing. Second, he has to get up in the night. Okay. 2 to 3 times to pass urine. So that are the early symptoms you get to know you are suffering from prostate. So if you have that symptoms, see a urologist, take medication, and you can be relieved of that. Now, even if you're not relieved by that, you can go for endoscopic surgeries like QRP. Now, the recent advances for prostate is like laser ablation. By laser, you can remove your prostate in one day, and same day you can go home. So it's not cumbersome. Even your sexual health life will be preserved by laser. Yeah.
Dr. Rajesh, tell me what precaution can be taken for this?
See, precaution, as such, there is no special precaution you can take because just like as you become old, prostate is going to increase in size. And cancer, you can't stop it. The most important thing is like, just like as I said before also, processed food is the most important cause for cancers also in this era. Along with that, you can take more of tomatoes. Tomatoes has a lycopene, which has a protective effect on cancer. That is very important. And second is, see a urologist regularly.
You know who to come and see for
see
sure.
A regular. Once you are 50, see a urologist and do the evaluation as we have done. We have made a special package, very reasonable, 6,000 shilling. We do ultrasound. You can consult a urologist as well as you do a serum PSA and a urine test. Altogether, comprehensive is then included. So even if you have a simple benign enlargement of prostate cancer, you will be able to know.
Okay. Yeah. That's perfect. Yeah. So what's the treatment for this?
Now, once you have prostate, basically there are 2 types of treatment: medicine or surgery. Medicine, the simple medicine you can take every day. By that, your urine flow will be good and the prostate will be delayed. You can just prolong prostates. Okay. The second thing is that along with that, if you're not treated by medicine, surgery is the last treatment available. In surgery, the latest advancement, no need to go for any open surgery, is obsolete now. Just go for endoscopy, QRP. By cystoscope, we remove the prostate and patient is okay in 3 days. That is one. Even if you want more advanced, laser is the latest thing. By laser, in day care, you can be treated and you are okay. The most important part every male should know about prostate is like with the prostate, once you do surgery, they have some sexual dysfunction. So you should ask a urologist before doing for surgery, so he can advise you the best treatment available. Okay, perfect. So you want to make your appointment, book that appointment right here at Meditest, and make sure that you come and see Dr. Rajesh to be healthy and safe too. Exactly. Thank you so much. Thank you so much.
It's been great having you here.
Same here. See you.
Perfect.